What you need to know to be prepared for your urodynamic procedure. Urodynamics refer to a series of diagnostic tests that evaluate the function of your bladder and your urethra. These tests may be recommended if you have urinary incontinence, recurrent bladder infections, a slow or weak urinary stream, incomplete emptying, or frequent urination. Urodynamic tests provide valuable information to help in the accurate diagnosis of your urinary problems. There are many indications for urodynamics to be performed: lower urinary tract symptoms, urinary retention, overactive bladder that is not responsive to conservative management, stress incontinence, mixed incontinence, incontinence after different procedures or surgeries, women that have pelvic organ prolapse who are considering surgery, and evaluation of neurogenic bladder. Urodynamics are performed in your doctor's office or ambulatory surgery center. These are usually either located adjacent to your doctor's office or in close proximity and are specifically designed for outpatient procedures. So there are a few risks with urodynamics, and these include urinary tract infections and lower urinary tract symptoms like burning and frequency. A specially trained urodynamicist will bring the patient into the procedure room and place them in a special chair or table. The urethra is cleaned and a catheter is gently placed into the bladder. Another catheter will then be placed into the rectum or into the rectum or vagina for women. Either sticky pads or needle probes will then be placed in the perineum, which is below the urethra above the rectum, to measure the EMG. Fluid is then instilled through the catheter into the bladder. Pressures of the bladder and abdomen are then measured. The urodynamicist will then ask you questions regarding what you feel. For video urodynamics, fluoroscopy, which is a special X-ray, will be used to see if the bladder and urethra move during voiding. After completing all the studies, the catheters and probes will be removed. A physician will then interpret the study within 24 to 48 hours. Uroflowmetry is a study to measure your urinary flow rate. You should come to the test feeling as though you need to urinate. Try not to empty your bladder 1 hour before your test is scheduled. You will be asked to urinate into a special commode that allows a computer to measure your urine flow rate and voided volume. EMG is a study that measures how well you can control your sphincter or outlet muscle and helps determine if they're working in coordination with your bladder. Sticky patches or electrodes will be placed near the rectum to record sphincter muscle activity. Video urodynamics is a study that allows the physician to see the shape and position of your bladder as it fills and empties. This is done at the same time as the test described before. A special fluid will be used to fill your bladder and X-ray images will be taken. A cystometrogram is a study to measure the bladder capacity, evaluating how your bladder holds urine and determine how well you can control your bladder muscle. One very small catheter will be placed inside the bladder and another catheter will be placed in the rectum. These catheters will measure both the pressure inside your bladder and the pressure your body exerts on your bladder. You'll be asked to report the sensations you feel as your bladder is filled, such as when you first feel the need to urinate and when that feeling gets worse and intensifies. You may be asked to cough, bear down, or stand during the test to check for leakage of urine. At the end of the study, you will be asked to urinate. The pressure flow study measures how well the bladder muscles, the sphincter, and the urethra work together. This test may be done sitting on a commode or standing. Your bladder will be filled until you feel that your bladder is completely full. You will then be asked to urinate. The computer will measure the strength of your bladder muscles and sphincter as well as the urinary flow rate and voided volume. Often, urodynamics are combined with cystoscopy. Cystoscopy is a procedure where a lighted telescope is used to look at the bladder. Numbing jelly will be injected into the urethra, and the urologist will take the lighted telescope or cystoscope and insert it gently through the urethra into the bladder. The doctor will then inspect the bladder and the urethra in women and the bladder, prostate, and urethra in a man. The procedure can take anywhere from 45 to 90 minutes. Please plan to arrive at least 30 minutes before your procedure. You do not usually need a ride home unless instructed by your doctor. Following the procedure, you may see blood in the urine and it may last several days. Please drink plenty of fluids to help flush out the blood. You may have mild burning with urination that usually lasts a day or two. Tylenol can help with this. You should be able to resume almost all activities immediately. A surgical scheduler will give you a date, and you may need medical clearance of your primary care physician or internist, including a history and physical exam. Rarely, additional testing may be necessary, such as blood work, EKG, and chest x-ray, and you will receive a letter with all this information and where and when to report. Prior to your appointment, you may be asked to complete a special diary or questionnaire. Please bring this with you to your appointment. You should take your normally scheduled medications, and you can eat and drink before the procedure. The series of tests usually take under 90 minutes to complete. You will be able to resume all normal activity, including driving, after the urodynamic studies are done. Your doctor will decide which procedures are appropriate for you. Please arrive to the study with a completely full bladder and arrive 30 minutes before your procedure time. The pre-authorization process is essential. We will communicate with your insurance company to find out your coverage and if any co-payments or deductibles are owed. We will provide you with an estimate of any charges that you may incur, and these are all due prior to the procedure. Payment plans can be arranged if needed. We hope that your procedure goes well and that you have a speedy recovery. We sincerely appreciate your feedback regarding your procedure, as we're always trying to improve the care that we provide to our patients. Should you have any questions regarding your procedure or recovery, please contact your doctor. Thank you.